Hi, Tori. I'm Dr. Katie. It seems that you had a partial seizure in the middle of LSB. For that, I'm going to prescribe to you Gabapentin.
What is Gabapentin?
Gabapentin, or its other name is generic, is Neurontin, Galase, or Horizont. Its major indications are used for partial seizures, post-herpetic neuralgia, restless leg syndrome, and an unlabeled use for neuropathic pain, prevention of migraine headaches, bipolar disorder, anxiety, and diabetic peripheral neuropathy.
I heard that its mechanism of action is unknown.
Well, it looks like you've been paying attention in your pharmacology class.
Yeah, I have.
Well, it may affect the transport of amino acids across and stabilizing the neuronal membranes. Its therapeutic effects are decreased incidence of seizures, decreased post-herpetic pain, and decreased leg restlessness.
What's the typical dosage?
Well, for partial seizures, like you had in neuropathic pain, it's typically 300 to 1200 mg by mouth 3 times a day. For post-herpetic neuralgia, it's 300 to 600 mg 3 times a day by mouth, and for renal failure, it's 200 to 700 mg twice a day, all given orally.
I also heard it's in pregnancy category C. Is that true?
That is very correct.
What is this drug contraindicated in?
It's contraindicated in hypersensitive reactions. It's used cautiously in all patients because it may increase the risk of suicidal thoughts and behaviors and renal insufficiency. In OB, it's contraindicated in pregnancy, and in peds, it's for kids under 18 for the sustained and extended release one. On under 3 years, it's for the immediate release because safety is not established. In lactating patients, you should discontinue the drug or bottle feed. And in geriatric patients, it may be more susceptible to toxicity due to age-related decrease in renal function.
What are some of the typical side effects of Gabapentin?
Well, side effects include dizziness, fatigue, ataxia, nausea and vomiting, fever, hostility, tremor, diarrhea, infection, viral infection, headache, constipation, abnormal thinking, weight gain, dyspepsia, blurred vision, and URI.
Are there any adverse reactions?
Why, yes, there is. It's leukopenia, thrombocytopenia, depression, suicidality, acute renal failure, Stevens-Johnson syndrome, hostility, dyskinesia, erythemia multiforme, angioedema, multi-organ hypersensitivity reactions.
Are there any drug interactions that I should be concerned with?
Why, yes, there is. Antacids may decrease the absorption of gabapentin. There's increased risk of CNS depressions with other CNS depressions like alcohol, so you should use caution when you're dancing at LSB. Antihistamines, opioids, and sedatives and hypnotics. Morphine can increase gabapentin levels and may, therefore, increase risk of toxicity, so you might have to adjust the dose.
What are some of the nursing implications?
Well, you should monitor closely for notable changes in behavior that could indicate the emergence of worsening suicidal thoughts, depressions, or behaviors. For seizures, you should assess the location, the duration, and the characteristics of the seizure activity. For post-herpetic neuralgia and neuropathic pain, you should assess the location, characteristics, and intensity of pain periodically through therapy. For migraine prophylaxis, you should monitor the frequency and the intensity on the pain scale.
Well, thanks, Doc. I think you answered all my questions.
You are very welcome. Continue having fun at your local LSB.